talk about the regional differences in type 1 diabetes, low rates, fasting countries. We know that we have many epidemiologic study about type 1 and diabetes. There are 3 important studies, EPDR with 13 countries, Dar MENA type 1 diabetes, and recently Dar Global Survey with 20 countries. And in this study, Dar Global Survey, about Ramadan fasting in people with type 1 diabetes during COVID-19 pandemic, it's important to see that Turkey, Morocco, and Algeria, the Maghreb, have the very short and very low rates of fasting during Ramadan for type 1. In comparison with Pakistan, with Malaysia, and other countries. And the result of low rest fasting countries, what I am going to speak about, came from analysis of the subgroup fast and non-fast of type 1 diabetes during Ramadan. In the Maghreb and Turkey, as I said, more than 80% of type 1 didn't fast, and no gender significative difference observed. The young age of the majority of patients is less than 40 years, and generally recent duration of diabetes. Are these 2 points can explain the high number of non-faster? Probably, partially. To the question, did you intend to fast this year? More patient type 1 diabetes, more than 79%, the response was no. And to the COVID-19 epidemic, did it affect the decision of refasting? The majority of patients say it didn't affect my decision. About the quality of glycemic control, we see that we have inconclusive results, and in particular according to gender. And about CMBG, more frequent for faster 3 to 4 times daily, and also for non-faster. About education and specific education, we note that there is some duration, 30 minutes of education of session in the majority, and specific education is given to faster and also for non-faster by physician during routine consultation. The presence also, the complication of diabetes is associated with high percentage of non-fast. It's an important point to see. What about hypoglycemia events only for faster persons? We note that hypoglycemia is observed in more than 68%, generally in the afternoon, and more than 48 break the fast. This event of hypoglycemia was not severe. What about hyperglycemia? This event is very frequent, more than 62% of fasters. And the majority of fasters didn't break the fast. And event of hyperglycemia was not severe also. In the summary, we can say that several studies for over the past decade have demonstrated that people with type 1 and type 2 has high fast in high numbers. But in Morocco, in Algeria, and Tunisia, and Turkey, more than 80% of type 1 diabetes didn't fast Ramadan. And no difference between male and female. And patients with type 1 who didn't intend to fast next year is very important. The majority, more than 79%. The young age of the majority of patients is less than 40 years, and generally short duration of diabetes can explain the number high of non-faster, probably, partially. Otherwise, COVID-19 epidemic didn't affect the decision refasting Ramadan for the majority, more than 82%. The quality of glycemic control is an inconclusive result, and in particular, according to gender. CMBG during Ramadan more frequent for faster, also for non-faster. Hypoglycemic and hyperglycemic events for faster are frequent, but not severe. And specific education, we see no difference, mostly done by physician in clinic during routine consultation for faster, and also for non-fasters. Duration of education, no difference, 30 minutes on average, and in particular according to gender. And the presence of diabetic complication is associated with high percentage of non-fast. How can this singularity of the Maghreb countries and Turkey be explained? We can say the similarity in sociocultural, religious, and medical habits of people from the Maghreb. Yes. Low degree of religiosity in the Maghreb. No. We know that holy month and fasting of Ramadan remains the most followed pillar in the Maghreb. Yes. Medical environment and access to care and medical consultation should be observed and studied. And we know that the fear of physician and specialist and the vitality of insulin of type 1 is associated with hypoglycemia and hyperglycemia events badly experienced by the patient and their family, give the general trend of health professional in the Maghreb in favor to preventive and safe approach. Thank you for your attention.